evening, all, and it's good to be back. And I do hope you had a good day and are ready to learn some new things and also have some questions ready for Dr. Uliana. Hi, Dr. Uliana, how are you feeling? It's good to have you back with us.
Hi, Carolina. I'm happy to be with you again. I'm fine, thank you.
This is great to hear then. And welcome back. This is another webinar with you. And thank you so much already for bringing this topic. This is definitely an interesting topic that we are going to have tonight. And as you can see, it is contemporary and effective alternatives after failed IVF with donor eggs. And of course, we will start with Dr. Liana's presentation on this topic. And afterwards, it will be time for your questions. So as always, just type those in the chat section. And I also want to still thank our ambassadors and partners. As always, you can see they are right here on the screen right now, and they are helping us. They are simply here to support us, and I definitely want to thank them for that, because it would be really hard to be able to simply bring so many of those webinars to you, as you know. So thanks for that. And I also want to mention that Dr. Uliana Dorofeyeva is the IVF specialist, director of international cooperations at IVMED Fertility Center, which is located in Kiev. She's also the medical director at OVOGENE Egg Bank, and of course, she will start with her presentation. So, Dr. Uliana, it's always great to have you here. And are you ready to start off with our topic today?
Of course, Carolina, thank you for a
Thank you
brilliant
so much.
presentation of myself. And as I said, this is great pleasure for me to be a part of these wonderful events and the project of Stronger Together in these complicated times. I appreciate everything what is done by IVF media and Egg Donation Friends, and always happy to support. And today I'm going to bring to your attention our recent results and experience regarding the contemporary and the alternatives, effective alternatives after failed IVF, not only actually with the donor oocytes, but also for the advanced maternal aged patients. Our biological clock is always running, and we need to count into our resources, and the resources for every woman and also for the IVF specialist. If we are talking about pregnancy and achieving the goal of the parenthood, is an oocyte, and oocyte is based on the ovarian reserve, and this is something what is given by the nature to every woman and has its limit. There is also a fact that we are not using all the potential we can use during our entire life, as every woman is using between, because we are having in our fertile period between 400 to 500 menstrual cycles, and in every cycle we are using only one follicle which is ovulating, and all the others, they are just destroyed, they are disappearing, meaning in the beginning of the menstrual cycles several follicles based on the ovarian reserve are recruited, and if they are not going to produce the oocyte, they are just destroyed. And this process is named atresia, meaning 99.9% of our resources are just wasted. And this is very important to mention to those patients who are now in their fertility times and they still produce the oocytes. If you are not looking into the decision of getting pregnant right now, you need to think about storing your fertility, preserving your oocytes, because age is crucial, and we will talk about facts which are related to the age. And also, this is the fact that anti-aging therapies are very common right now, and probably many of you were facing them mainly for cosmetology right now. But we also need to think about those in IVF. Why? Because every decade, age of women delivering their first baby is increasing for 2 years, and this is the average statistics from the world. There were some exceptions, of course, but if we will continue the trend, we are going to deliver babies in the patient's 50s very soon, in 2100. So we as a professionals should have a decision. And there is a decision for those patients right now, and really great decision is an oocyte donation, which will give us the opportunity to have a clinical pregnancy rate and the success rate of the even initial treatment cycle on the level of over 50%. And this is independently on the age of the patient. This would be the same for the patient of 35 years old with the diminished ovarian reserve or for the patient of 45 years old. But if we are talking about using own oocytes, the success rate is decreasing and it's rapidly decreasing after 35 years old, mainly by decreasing the quality of the oocyte, but also the quantity of the oocytes. What we should talk about the oocyte quality. So poor egg quality is one of the main causes of repeated failures in assisted reproductive treatments, and the quality of the oocytes is mainly determined by small organelles which we named mitochondria, and they are located in the cytoplasm of the oocyte. And those mitochondria, their main role is to supply the energy for the cells. And the energy is needed to power the cells' biochemical processes. So, for the oocyte, in order to be fertilized and to develop the embryo, they need to have that energy. And if we are comparing the young oocyte and the aged oocyte, you can see on the picture that the young oocyte, it has a lot of mitochondria inside, and the function of this mitochondria and the status is really high. And for the aged oocyte, we can see already decreased mitochondrial DNA levels, decreased number of the mitochondria inside of the cell. We can see morphological changes in those mitochondria and increased mitochondrial DNA deletions. This also have an impact on the function of the mature oocytes. And probably many of you faced already the fact that first, our success, if we are talking about stimulation, is number of growing follicles. And if we are facing several growing follicles, doctor always says that it's not comparable that every follicle will have oocyte. And of course, not every oocyte will be M2 oocyte. So if we are talking about aged oocyte, we need to talk also about of having oocyte and having mature oocyte. And this is always different, mainly because of the function. And aged oocytes and the mitochondrial dysfunction will give us lower IVF success rate, lower fertilization, and higher aneuploidy rates. This is the statistical data presented in a table for many numbers of the blastocysts being checked for different categories of the patient in their different age. And you can see the groups. Please have a look into the group of over 40 years old. Independently on number of the blastocysts which were checked for this population of the patients, the aneuploidy rate, meaning percentage of abnormal embryos, will be 70% and higher. And we need to consider the fact that number of the blastocysts is of the entire oocytes is also low because of the diminished ovarian reserve. So we have two problems. We have very limited number of oocytes. That's why the probability of getting blastocyst is low. But even if we are getting blastocyst, the fact that this blastocyst will be genetically healthy is also quite low. But just have a look into the first column with the light green. This is the group of the oocyte donors, and we will get to that a bit later. This group is also facing some percentage of abnormal embryos, and we will discuss why it is happening. So the solution for those patients in their advanced maternal age, there is available, and patients who are dealing with poor oocyte quality and experience several IVF failed attempts due to the impaired embryo development have to be treated with conventional oocyte donation program to be able to have a child. And this is something what is happening worldwide, of course. What causes the poor oocyte quality? It's maternal age, ovarian reserve, genetic factors, endometriosis, and the changes in the mitochondria as we just discussed. So, but why egg donation should need to have an alternative? Because we understood the process that mitochondrial degeneration will decrease the chances for the and the probability of creating the embryo. And if we have the mutations in the mitochondrial DNA and there is a lack of energy, which does not allow embryos to sustain fertilization and to develop further, in case we can solve the mitochondrial degeneration problem, we will have chance to repair nuclear function inside of the oocyte. Egg donation is always easy alternative to achieve pregnancy, but still there are psychological, ethical, and physiological considerations, both from the clinicians and mainly from the patients. We all know very well that not every patient would consider the oocyte donation as their priority or their treatment option. Egg donation need an alternative because every individual person have a right to have child and carry up their genetic material during the pregnancy. And those alternatives right now are two. This is spindle transfer or pronuclear transfer. And you can see the graphs of how it is performed in this picture. But of course, we will talk more in details about each of the procedure. So in order to understand the process, we need to start from what is the spindle. And the spindle is a small organella inside of the cytoplasma of the oocyte, which is responsible for the cell division, responsible for fertilization and embryo development, and also for the genetic potential of the oocyte. In order to determine the spindle, we need to have only a special software and polarization system on the microscope. And this can be done, and it is done only in very limited number of the clinics all over the globe. And system needs experienced specialists and high cost investing. And this is what we do in our clinical facility, IVMED in Kiev. So what's the spindle transfer in terms of the how it is happening? It's the replacement of the entire cytoplasm of the poor oocyte quality. This procedure is based on the transferring of spindle, which consists of the genetic material of the oocyte from the affected woman, from the patient meaning, into the donor oocyte with the healthy cytoplasma, which had their spindle removed before that. And the oocyte resulting from this procedure with the repaired cytoplasma can then be inseminated by the conventional techniques ICSI with the sperm of the patient's partner, giving the intended parents a chance of having a child genetically related to them. Meaning we are having a healthy cytoplasma of the donor, we are getting a spindle from the mother's oocyte, we remove a spindle from the donor oocyte, and after creating such an oocyte, we perform fertilization and are checking the further development of the embryo. Advantages of the spindle transfer is the fact that there are many families which are affected by the serious mitochondrial diseases, and by this treatment, those families and the children can be free of devastating and the critical, very often life-limiting diseases. The US study suggests that mitochondrial donation could prevent more than 12,000 women in the US from transmitting mitochondrial diseases, which will save more than 700 babies from those diseases annually. And of course, if you would add the numbers from Europe and Asia, these numbers will be much, much higher. Maternal spindle transfer has been tested on human oocytes, and method led to the development of the blastocyst. This method is less mechanical and morphological, has less mechanical and morphological damage during the manipulation. And what is the pronuclear transfer? Pronuclear transfer is also the method when we do, it consists of performing in vitro fertilization using the oocyte of the patient. Those mitochondria contained mutant mitochondrial DNA and the sperm of the further father, and subsequent extraction of the pronucleus on day one of the development, after 24 hours after the fertilization. So we have two cohorts of the oocytes, donor oocytes and the patient's oocytes. We fertilized with the male partner sperm both cohorts, and on day one, after checking the fertilization, we took the pronucleus from the donor oocyte out, and we took the pronucleus from the patient oocyte, and we took the pronucleus of the patient into the donor cytoplasma, meaning donor cytoplasma is supplying the energy from the young mitochondrial to those pronucleus, which are developing further and creating the embryos. Advantages of the pronuclear transfer are that there is almost no risk of fertilization damage because the transfer is already done between the zygotes. There is better blastocyst outcome. This technique also works absolutely great for the patients with the mitochondrial diseases, and technique and the mechanical micromanipulations requesting experience and the special cultivation method after the micromanipulation. Which results we are having right now? We have 38 patients with total number of oocytes of 177, and number of the fertilized oocytes after spindle transfer is 124. There are different figures which are absolutely the same and sometimes even higher than we compare this group with the group of the regular egg donation treatment or treatment with own oocytes. I would like you to pay the attention into the blastocyst rate. And blastocyst rate after the spindle transfer was 67%, and after the nucleus transfer, 75%. Embryo transfers were done already for 18 patients. Number of clinically pregnant are 9, with 4 live births, and ongoing pregnancies are for 5 patients. How it is usually organized in terms of the planning for the patient? We are trying to avoid the first visit for initial consultation and the screening, and also the stimulation process we are arranging with the local clinics in the home countries of the patients, with some acceptances as those countries where cannot cooperate in those terms. But mainly patients are coming for only one visit, which is lasts for 7 days in average, which is oocyte pickup, fertilization and the manipulation techniques, and embryo transfer itself. I will be happy to explain more in details if somebody of you will have detailed questions, and also by emails. Another issue which I would like to present to you is the absolutely new and unique technique of genetically certified oocyte technology, which was developed by the scientific team of the OVOGENE Egg Bank. And you remember we were talking about the light green column in the statistical data of abnormal embryos. And this was the column of the oocyte donation. And it says that about 30% of those blastocysts will be abnormal. So it was very interesting for us to get and to confirm those data with our data, local data, and also to avoid having those problems for oocyte donation. So how we do this for our oocyte bank? After we receive the cohort from the donor, all the oocytes are assessed for the strict morphological criteria, and they are divided into groups of quality 1 oocytes. These are ideal oocytes with any morphological disorders, and quality 2 oocytes. These are oocytes with some morphological disorders, meaning shape, size, some organelles inside, etc. And those oocytes are not used for the vitrification for the bank, meaning we select only best quality morphologically oocytes. But after that, we are checking them also in the polarized lights under the special system, the microscope, to see the spindle. So we are checking the fact that the spindle is there. So all the organelles which should be, they are present and they are absolutely fine. But after that, we decided to check the genetic status of those oocytes. And in order to check the genetic status of every oocyte, we took the polar body biopsy. You see on the screen this small cell surrounding the oocyte. This is a polar body. So the unique feature of the female gamete is that the polar body can present beneficial information about the genetic background of the oocyte, and we can remove this without potentially destroying the oocyte. And polar body biopsy has been applied as the pre-implantation genetic diagnosis test to detect the chromosomal and genetic abnormalities that might be inherited for the offsprings. And the advantage of polar body biopsy NGS testing from the patient perspective is the fact that the oocyte donation program mostly bring financial responsibilities for patients, and each of the oocyte is considered as a potential embryo from the patient perspective. And there is a true and there is a fact of expecting this. Euploid potential oocyte has much bigger chance to achieve good quality euploid blastocyst. Most of the oocyte donation programs in different clinics does not require NGS or PGS testing before embryo transfer. That's why euploid oocyte will give the highest chances possible for the clinical result. So the genetically certified oocyte, this is a cohort of the oocytes which were assessed morphologically. After that, we performed NGS-based aneuploidy screening for those donors' oocyte. Then we did NGS-based carrier screening for oocyte donors and targeted parental risk gene analysis. And this is the data to share with you as well. So the data from IVMED clinic, number of polar body biopsies were performed for 1,978 oocytes. All those oocytes, after performing the biopsy, were successfully vitrified. Number of euploid oocytes after performed NGS testing was 7497, so almost 75%, meaning 25% of those morphologically selected oocytes were uneuploid, meaning from those oocytes, even if they were morphologically great, we shouldn't expect the blastocyst, or the blastocyst, if there would be a blastocyst, would be uneuploid blastocyst, meaning if without testing we would transfer that blastocyst, we would not get into the clinical pregnancy. Number of survived oocytes after sowing was extremely high, 98%. If we are talking about general population of the vitrified oocytes from the bank, so survival rate in a good clinical laboratories are between 92, let's say even 90 to 96%. And this is really great numbers. So for the genetically tested euploid oocyte, survival rate was 98%, fertilization rate 98%. Also, the average fertilization rate is between 80 to 85. Number of blastocysts of highest quality. It's not total number of blastocysts. This is just the highest quality blastocyst was 52%, and the implantation rate was almost 60% for this group. So once we are talking about genetic status of the materials being tested in the IVF to increase significantly the chances for the patient, this should be either oocyte NGS testing or PGTA testing for the embryos. A few words about Ukraine. You know that we are located in the east of Europe. All our IVF clinics are private, and so far we have over 60 IVF clinics practicing. Our regulations regulate absolutely oocyte donation and surrogacy, and also export of biological materials. That's why Ukraine, until the COVID status in the world, was one of the popular destinations for oocyte donation treatment and surrogacy. But because we know that the world has been changed, we also changed our strategy. And the strategy right now is for those brave patients who are ready to come to Ukraine now. We are happy to treat them, and we are having those patients almost every week right now. but many of the patients would prefer to stay in their home countries. So we changed our practice, but for me, this is the practice for over 12 years already, to export biological materials from Ukraine into the different destinations. And we do this for almost all continents. And if you have that need, you need to contact your clinic and find out if they can receive, or if they are probably receiving right now materials from us, from Ukraine. And if not, we will be happy to coordinate and to make this happening. So you should avoid traveling, but materials should travel to you. By doing this, we are offering frozen donor oocytes. We can create also embryos for those who have a medical need to have double donation. We are offering sperm samples, and we take care of the safe cryo shipping of all those materials into your location. We have wide database of the donors. We are acting according to the regulations of Europe, Latin America, USA and Canada, and Australia, meaning we are following the screening regime, we are signing the consents with the donors. Donors may be anonymous and identifiable. It is very easy to select them from the database. In order you have that need, you can contact me or our team lately. If we are transporting materials, we do this according to the international regulations for the transportation of the cryopreserved materials. And the company who is doing this is Arcrio. They also work with the insurance companies in order to ensure that the safety will be checked during all time the transportation. From the clinical perspective, many patients are asking, we did already several treatment cycles. We were not successful. Something is not working. Probably this is the time to stop for us. So I would like to address this today. When do we need to stop? And there are only really few reasons why to stop and when. First, and very important, of course, this is the medical consideration. Meaning, if carrying the pregnancy or any kind of IVF treatment can perform any damage to your health or to your status, of course, we should not continue IVF treatment. There is an age limit, but that age limit is in some countries. In Ukraine, by law, we do not have an upper age limit. But of course, we are considering every patient individually and considering point number one. So if there is any risk, we would not be deciding to perform an IVF treatment. And there are limits for treatments in the home countries, such countries as, for example, France or Germany, where egg donation cannot be performed. But we are talking mainly about the fact that transferring the materials to your home country, meaning from those countries, you definitely need to travel somewhere to receive the effective treatment or oocyte donation treatment. But if you are not ready to come to Ukraine, you can come somewhere closer by to you, and we will be happy also to cooperate in this need with you. Also for the motivation, you know that Israel is a country which is paying for all IVF treatment cycles for the patient until the family has 3 children in their family. So the Israeli group of the doctors presented the paper where they calculated the success rate for all the patients where they were checking and supervising for 4 years. So 95% of couples conceived, 89% of couples gave birth to live infant, 81% achieved live birth within those 4 years, and 85% with 8 treatment cycle. And another data, we all know how UK is great in terms of gathering, analyzing, and presenting the data. So this is a huge data from UK registry for over 150,000 UK women and over 250,000 IVF treatment cycles. And it's all for women over 40 years old, and they are divided into 3 categories: using own oocytes, using for the ages over 40, and own oocytes for age less than 40, and donor oocytes for all ages. And you can see that with 9 or we see the plateau after 6 treatment cycles. With own oocytes, it was not higher than 35%. With own oocyte, it was increasing starting from first treatment cycle up to 5 treatment cycles, up to 65%. And for the oocyte donation, with 6 treatment cycles, it was close to 90%, and over 90% if we performed more than 7 or 8 treatment cycles. So, meaning more trials you have, more cycles you do, this is bringing you closer to the success. And to conclude, different treatment options may be recommended for IVF to achieve a goal of parenthood. Second opinion is recommended due to specific limit and availabilities in the countries. The most effective treatment for patients in advanced age is oocyte donation. Experimental treatments available in IVF and effective and may be accepted widely in the future. Just to say that IVF itself has only 42 years old already. So, meaning it was experimental just several years ago. That's why, in order to develop something, we need to try something new. Genetically certified oocyte is advanced, unique technology which offered by OVOGENE Egg Bank to increase chance of euploid blastocyst outcome and pregnancy chances. Genetically tested oocytes has significantly better euploid blastocyst and implantation outcome. Chromosomal abnormality risk dramatically decrease after the polar body NGS testing. And last, but very important, if you are listening this webinar and haven't tried all mentioned above, you should keep considering trying more. And of course, you will be successful. Thank you so much for your listening and for your attention. I will be really happy to answer your questions. And you can see my contact details in case you would like to get more detailed explanations and answers. You can always ask the questions by email. And the contact details of my team members from IVMED Fertility Center, from OVOGENE Egg Bank, and from the courier company. Thank you so much, and ready to answer the questions.
Thank you so much, Dr. Uliana, once again for a very interesting presentation. Lots of details, and actually quite a few things that are kind of still complicated and new as well, like spindle transfer. So thank you so much for bringing this, because I loved what you said about the IVF, that it needed several years, more than several to be at this point as we have today. So we just need to wait for some more details on that as well, right? Perfect. Thank you so much. And just to remind everyone, if you have any questions, just go ahead and type those in. And of course, there are people typing right here as well. And we do have a very first question. So let's get to that one. And it is from Andrea. Is this possible to ship material to Germany?
Because of the regulations in Germany, which is limiting oocyte donation, if we are talking about donor oocytes, this is impossible to transfer those materials to Germany. You can consider coming to Austria, probably, which is closer, or to some countries where oocyte donation is legal. If you are talking about, for example, NGS testing for your own oocytes, but let's say you would like to do the NGS testing for your own oocytes and transfer your own embryos back to Germany, this can be done. But donor materials, unfortunately, no.
It's like a follow-up right here. So
Right.
genetic
Yes.
material, sorry, is from parents.
Mm-hmm.
Then it is possible. And another
Mm-hmm.
follow-up, sorry, from Andrea. So also with spindle?
Yes.
And wonderful. Thank you so
No,
much.
with spindle, I'm sorry, Andrea. If this is a spindle transfer materials, so they are related to the oocyte donation. So this is called like a 3 parents baby. This would not be considered in Germany to be accepted,
All right.
unfortunately.
Okay. So only, of course, with your own oocytes and, of
Only
course,
own.
genetic
Yeah.
material. Not with any egg donation option there.
Yeah.
Of course, thank you so much for the clarification to this one. Then, of course, as well, there is a thank you from Andrea. And we just need to wait a bit because I do see someone is typing, so we just need to wait for that another question.
Mhm.
So let's have a look. And of course, I encourage anyone if you have anything that you would like to ask, go ahead and do it. And maybe in the meantime, I do have a question that actually comes up quite a lot. I'm sorry, I'm not sure if you mentioned this before, but when it comes to spindle transfers, is there like an age limit for this? I mean, do you accept people at some point or at some point not?
It's a good question, Carolina. I didn't mention this in my presentation, but of course, like we should consider not I would say not an age limit, but the limit of being able to provide the materials. Meaning, we can after we access the patient and we know the FSH, IMH, antral follicle count level. We are checking the previous outcomes for the stimulation cycles. We are selecting optimized stimulation protocol, and we expect to receive at least 2-3 zygotes from that patient. This is a good candidate to go to ahead for the spindle transfer. The average age we are talking about 40 years old, but sometimes we may accept patients in their 42, and sometimes patients in their 39 cannot be accepted due to the ovarian reserve and the previous stimulation failures.
All right, thank you so much. And actually, someone is asking quite a similar question here. So, for a patient over 45 who has irregular ovulation, would it be possible to use own eggs and spindle egg donation in the UK?
Um, Irregular cycles means already that the patient is in her premenopausal period. So this is not, it's better to consider the IMH level and antral follicle count. Also, if there were previous stimulation cycles, what was the outcome and the how patient was responsible for responsive to the gonadotropins. For some patients, we can consider the option of several stimulation cycles and getting all the oocytes or fertilized zygotes together. But I see this is IMH 0.2. This is really unlikely that we would consider that patient into the spindle transfer. For such patients, we are trying to offer also so-called combined oocyte donation. So we go ahead with the stimulation of the patient, and then if we are receiving biological material from the patient, like 1 or 2 oocyte, we are also fertilizing them by the male partner sperm and cultivating in 2 different dishes: own oocytes and donor oocytes. And if we are getting embryo, we're deciding which embryos we are going to transfer. But with 0.2 and 43 years old, considering the spindle transfer, this is really unlikely. But we can consider receiving the more medical tests and the results, and probably the response for the stimulation was better. So then it can be possible.
Excellent. Thank you so much for a thorough explanation to this one, of course, as well. Let's have a look, okay? There's another question from Andrea. So, are there partner clinics in Belgium or Netherlands, Luxembourg?
Andrea, I think I need to
Or
get
spindle?
to
Yes,
you, yeah,
transfer, sorry.
to get your answer after consulting my colleagues, because like we have now experience to transferring materials to Luxembourg. As I remember, Belgium also has some issues, but this is a good question, but I cannot answer this immediately right now.
Mm-hmm.
Like
Of
we
course,
had no
that's something.
experience so far.
That's something that would need to be checked. Of course, I do
Yes.
understand that. No problem at all. So we can always forward your question. I'm sure it's possible
Mm-hmm.
to double check it so that you can get your answer as well. Thank you so much for that, then, of course. Let's have a look at the next question. So, if I want to try the spindle transfer, how many eggs will I need to provide?
We are expecting at least 2, 3 zygotes to start working and scheduling the spindle transfer. And meaning 2, 3 zygotes, if we are expecting fertilization rate of 80%, meaning we should have 3, 4, better 5 oocyte being collected and be mature.
All right, excellent. Thank you for that. Next question is up from Vanessa. And spending is an option to consider after using own oocyte is exhausted. How, if any, will I be related to my baby? I'm using a sperm donor, so it is important to be related to the baby.
Vanessa, it's spindle transfer is an like we consider a baby of being 3 parent baby. We cannot like there is no opportunity right now to provide of specific percentage of how much you will be related, but because spindle is involved into the uh, dividing cell division and also consists the genetic materials, your genetic materials, so that baby will be related to you, but also to the donor because donor is providing the genetic material and to the sperm donor as well. So we call those babies 3 parents baby.
All right. Again, thank you for the clarification. Next question. It's actually something that definitely comes up a lot. So, is it easy to get into Ukraine for treatment these days?
Yes, it is quite easy. And as I said, patients are arriving to Ukraine right now for their treatments. What we are recommending this is to consider an international insurance to cover COVID as well. But we had some period where the borders were closed for foreigners, but now it's ended already. So there is no limit for anybody to come into Ukraine. There is a recommendation of being tested, of course, and probably this is the recommendation from your home country. But there is no need to be staying on the quarantine if you have any symptoms, etc., something like this. And there is no requirements for providing any medical confirmation letters or something like this. If this will happening, because like we are facing right now the information that maybe this will happen again soon for the Christmas period. But before that, it was resolved by providing a certificate or the official letter from the clinic that your reason of visiting Ukraine is medical treatment, and this was an exception. So for medical treatment, anyone was able to visit Ukraine, even during the borders were closed.
All right, thank you so much for that. Then it's good to hear that it's definitely possible, and you are able to take care of those patients as well.
Yeah.
Perfect. Thank you so much. Okay, and let's have a look. Next question is up. So Andrea is asking, can they be collected over several cycles and vitrified? Sorry, those 2 + 1 + 2 to get 5.
Yes, this is something what is offered for some patients, but we need to understand also the time frames, and we are explaining this to the patient, of course, that one stimulation cycle, you understand, this is 1 month, and then the second cycle, usually we recommend to rest, or we are checking the antral follicle count, and then we are stimulating only after 1 month's break. So in order to perform 3 treatment cycles, we need to have 3 visits to Ukraine. We need to have about 6 months' time. But yes, it is possible.
And thank you again for explaining that one. And let's have a look at the next question from Wendy. So, thank you. Do you have partner clinics in the UK who will treat over 45 in combination with your clinic?
Um, UK clinics, because they are having a limit, they will not accept a patient for IVF treatment in their overage. But if a patient is coming to the clinic in order to receive ultrasound diagnostics or hormonal levels measurements, this is happening and this can be performed. But the responsibility for the treatment cycles is totally on us, on Ukrainian clinic.
All right. Again, thank you so much for that. And again, someone is typing, so we just need a second to see the next question. And just a second then. Yep, right here, of course.
Mhm.
I'm okay with collecting oocytes over several cycles and coming to Ukraine. How much time do I need to reserve this for?
So we need to again to coordinate your menstrual periods. Initially, we need to have all your blood work and the screenings which we are requesting in Ukraine to be done and to be sent to us. We will check all those. If everything is fine, also we need to have a GP clarification and confirmation that there is no risk for carrying the pregnancy and contraindications for IVF. If this is all available, we will be able to assist in preparation the stimulation protocol. The protocol will be given to the patient, and if patient has a treating physician who are ready to assist in the home country, they will be together with our control. We will be in touch with like our doctor, our coordinator, the doctor of the patient in the home country, and the patient herself. So four of us are coordinating all the processes, and based on how long can we coordinate this, like what can be performed in the facility in the home country, we decide when patients should come to Ukraine. For example, we also had a practice when clinics performed even egg retrievals for the patients. They fertilized their oocytes, they created zygotes, and the zygotes were transferred to Ukraine for further spindle pronuclear transfers. So, if we are talking about pronuclear, you remember the scheme. We need to work with the pronuclear stage embryos to take the pronuclear from one oocyte and to put it into the cytoplasma of the donor oocyte. So this was even done with some clinics by sending zygotes to Ukraine.
And wonderful. Thank you so much for yet another question and, of course, for your answer. At this point, we are waiting for some questions. So, of course, let me remind everyone we will be slowly finishing. But, of course, if you have any questions left, go ahead and type those in right now so we can help you out. If not, of course, we will finish. However, remember that you can also always get in touch with Dr. Uliana via email. She has provided you the emails. You can also use the link to the site. I will send it right here. And of course, you are able to get in touch with Dr. Uliana. And I'm sure then you will be able to get some more details as well. And I'm sure Dr. Uliana always will require more details from you to give you a thorough answer as well. And well, at this point, I do not see any questions, so we will be slowly finishing. So thank you so much, Dr. Liana, for a brilliant presentation as always, with lots and lots of details. Remember, it has been recorded, so if anyone has missed any part of it, will be able to see it as well. And before I let you go, Dr. Liana, is there anything you would like to add?
Thank you so much, Carolina. And as I said, alternatives and the spindle transfer, pronuclear transfer, this is something new for IVF. It's new for us as a professionalists, as doctors, and also for the patients. But if we are considering all the data we have, we are absolutely sure that we may offer this to our patients, as well as the NGS tested donor oocytes. And we are happy to do everything to improve our chances, to give highest chances for our patients, specifically right now. Like, we have no possibility and no time to plan multiple attempts. We need to do everything right from the very beginning and in the very first cycle. And this is our attitude, this is our aim, and this is how we work. So I will be happy to provide any additional information if needed. And I wish all of you, all of your patients, great success and achieving a pregnancy and any goal as soon as possible, even facing the status in the world right now, but still many options are available. Just remember about this. We need to think differently and act a bit differently, but it's still possible. Thank you.
Yes, thank you so much. That is a perfect summary. And so what else can I add to this? Thank you so, so much for that. And as you can see, there are some thank yous, of course, for you right here as well. And remember, it has been recorded. It will be available on myivfnces.com and, of course, our YouTube channel. And you know that you can find all kinds of previous webinars with Dr. Uliana as well on our site. So you can use the link I have sent. There are some other webinars with her as well. And well, thank you so much, Dr.
Thank
Uliana. As
you.
always, it's
Bye
great
bye
to
and
have you
take
here.
care.
Have a lovely evening or day. And Dr. Uliana, I do hope to see you soon as well. And have a good, good evening. Thank you all. Bye.